Welcome back to the Exam Room Podcast, where we explore the real-world challenges and opportunities shaping healthcare today. In this episode, Dr. Rhiannon Winsor continues her conversation with Geneva Miller, founder of Equipped Healthcare Solutions, to discuss why traditional patient education methods are no longer enough. From health literacy and chronic disease management to medication adherence and care coordination, Geneva shares practical insights from the front lines of nursing and value-based care. Together, they explore how healthcare organizations can move beyond pamphlets and rushed appointments to create more meaningful patient engagement through repetition, community outreach, culturally competent education, and compassionate care.
We're back in the exam room with Geneva Miller to continue our discussion about medication education and care coordination. Let's talk a little bit about why traditional patient education isn't working. I had an interesting meeting with a CEO of an organization, and we were talking about education. And she said, our health centers are not asking for help with education. And I thought that was very interesting. I've been in education for a lot of years, adult education and healthcare, and I'm on board with education. I think it's answers a lot of questions, solves a lot of problems. We're all recognizing it's important, but most systems are still relying, like you said before, on handing the patient a paper. Or in one health center I was at, there's like a laminated stack of sheets that if somebody has the high BMI, they give that to the patient while they're in the exam room so they can just look through it, right? So we're using these messages, but it doesn't seem to be working. Do you think that's enough or it isn't enough? What are your thoughts?
I personally don't think that it's enough. I know even in school, so I was a writer. Even though I listened to the lecture, I would write on my slides, and then when I was studying, I would write again. So the more you repetitively do something, then it gets into your brain, right? There was one, I think it's called like the teach back method. So now I'm saying to my patient, I just explained this to you. Can you say it back to me in your own words? Even if we did that during a doctor's appointment, right? Even if we had on Wednesdays, we have someone come in and we're going to teach about diabetes. Thursdays, we have a nutritionist come in and they're going to cook a meal, right? Or, we just something, because again, people won't come for food. If you tell them we got snacks, people are going to come for snacks, right? And if it's I think again, a lot of things, cardiovascular disease, and that's unless it's like a genetic anomaly or a mutation, it derives back to the way that we eat. It is centered on something that's, something that's going on. So if we can do something where we had, again, education centers, I know that if we think about we have job training centers. We have a lot of online learning. There's a lot of things that we do, but do we take the time to have someone come out? Now, granted, not everyone's going to come out, so that will always be the stipulation, or the one who's a skeptic. Well, not everybody's going to come out. That's fine. Not everybody's going to take their medication, right? Not everybody's going to come back to their follow-up appointment, but you still come to work every day. I go as a nurse, and I'm still going to educate. So what can we do to make it more hands-on? Do we, again, ask these questions? Do you have somebody at home who does all the cooking? Who else can we, come if you're busy? Because again, I'll go back to dialysis. People now have to spend 12 hours out of their week in the dialysis center. So now I'm on part-time hours, right? Unless I worked overnight or something like that. I'm tired. So if I was the breadwinner, now I'm feeling a certain type of way. I might be feeling like I can't take care of my family. So who else can I call on so that you can go to work and somebody else can come in and explain this to you that has some time? We have to think outside of the box. Again, we're so used to doing things the same way that it seems like insanity, right? Insanity is
Yeah.
doing the same thing over and over again, expecting different result. It's not working. And the
Hmm.
only thing that we're doing is we're prescribing more. People are having, more medication errors, even though we have AI, even though we have the electronic health record, things still happen. There's still errors. People still get around and do different things with the healthcare system. But I think we need to go outside of the box
Mm-hmm.
and come up with different things, especially when it comes to cultures. Even speaking to people, different
Yeah.
cultures, they don't talk face to face, or they look down. We
Hmm.
just have to think outside of the box. And for me, I think it involves education centers. Again, let's do a little budget, have somebody come in and do some classes and see how that works. Maybe also too, the other thing, have a day where everybody, I think they do this in, it's called gram rounds, but have a day during maybe twice a month where the vascular surgeon is there, the other person is there that can connect the dots, and we can get the education at one time because we might not be able to catch them again. Just something. We have to now we have to become servants, and not servants like slaves or maids and different things like that, but I'm serving you as this is my profession. I have an oath, right, to
Hmm.
treat you. So let's think of it as service. I want my patients to have this outcome. How can I serve them better?
Absolutely. What are your thoughts about? I mean, it appears that health centers aren't really focusing on these things like they should. Why do you think that is? We recognize, and I'm going to assume health centers recognize too, that education is an important piece, but
Hmm.
why aren't they doing these things? I mean, I'm sure some are, but why are
Hmm.
most not? If they know it's important, why aren't they doing it?
Why aren't they doing it? In my opinion, I really think it has to do with time. And I also think it has to do with money, because it's going to take more manpower to service the people that we need to serve in in a way that's sufficient, right? There are a lot of, again, I don't know the statistics, but there are a lot of people who are diagnosed. Let's say they're on their CKD, and the timing of those appointments, again, we only have to see them maybe every 90 days, depending on the stage. And then it starts to become more frequent once their disease process gets worse.
Hmm.
But if I don't know, or if nobody's coming in to get the labs, or if I don't have enough staff or CNAs to call the patients back and say, hey, it's time to get your lab work, that's how people slip through the cracks, right?
Hmm.
So capacity. My office might not have capacity. I'm still using paper. So paper charting. Like, there's a
Hmm.
lot of things I think that goes into it. The successful ones are doing it well, because when I went to that conference and the physician was telling us about, how we can learn more and how we can talk to providers in different ways so that we can feel like we're all on the same team, that was needed as a nurse. But I really
Hmm.
believe that it comes down to the financial piece of it and the time. I need to
Hmm.
have the manpower to do this education piece, but I'm still on the other end possibly being penalized for something that I have no control over, because I am a small doctor. I'm not in a hospital where I can afford these things, right?
Right.
So I think that there's a lot of grants and things, even with like government contracting. And one of my goals with Equipped Healthcare Solutions is to look up and create programs where we can, get a fund from the government, right? And we're talking about things ahead of time. So we're getting ahead of the curve, because that's what we're trying to help people when the country doesn't have a lot of health literacy, right? We have a lot of fast food. We have a lot of things where, and like you said, I'm gonna take the pill and I'm still gonna the pill is gonna help, and I'm gonna keep living my life.
Hmm.
So we get you to the doctor, but we don't help to reshape and reframe your thinking, and not trying to brainwash people, but I want for them to live longer and healthy, not
Hmm.
80 and I can't see my grandchildren or my great grandchildren graduate. So
Yeah.
I think it's more of a financial thing, and for all of us, if we've been in healthcare is hard.
Hmm.
It's not an easy place to be. So I think in order to change healthcare, we have to change the way that we are thinking when it comes to how much is this going to cost right now, and how can we get ahead of it. We might be in the red for a little bit, but after, the outcomes will be better, and then the disease processes will lessen because the people are getting the education that they need.
Hmm. Absolutely. Are there any, for listeners that are listening to this thinking, yes, 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 Geneva, you are right. Those are the reasons why we're not doing this. What would you say to them? Are, in your experience, are there some baby step things that they can do still in this situation where they have a limited capacity, limited resources? What other suggestions would you have?
I, YouTube is always free. Now, of
Mm,
course, you have to vet the people who you listen to on any social media platform, because everybody is Dr. Know-it-all, for lack of a better word.
yeah.
But what I would say is poll your poll where you are, your employees, um, and start there. What is it that they feel as if they are lacking? So for example, one of the things that's important, again, to me in any work that I do, is that the education comes beforehand. So even if it's a workshop, right, where we're discussing, again, I'm gonna go back to dialysis, where we're discussing education about different food types. We're talking about, what things to look for. That's a really easy thing. Signs and symptoms of 1, 2, 3, right? And let's say you have a TV, and everybody has a TV in the waiting room. Instead of putting on the news, instead of putting on, Jerry Springer doesn't come on. I think he passed away. That was showing my age. But um, let's have a something on that is giving tips on whatever office I'm in. Well, this is how you know if something's going on with your heart. Again,
Mhm.
it's going to be general, but
Mm,
there's something that they're hearing. Because when they come back, the same video or new video is on and I'm hearing it, right? There has to be something that can catch their eye. We do have those pamphlets, but there's free versions of, AI software. And one of the, as a physician or as a healthcare provider, there are ways that we can do things and use AI to our advantage. So what free resources can I create? There are things that I will do. What workshops can, my patients, attend in my area that's free? That's another thing I think that we don't do, and not prideful, but I feel as if there may be some local resources that we don't know about because we don't have time to get out into the neighborhood, right?
mhm,
So in my community, are there any local workshops? There are a lot of
mm,
people who are consultants that do workshops with, like, lawyers offices, or the local food bank. Somebody's probably going there and doing some sort of educational series, and if they aren't, then you can think about doing that now.
mm,
Because at a local farmers market, just having a stand, you know how people go out and they evangelize? Let's go to the local farmers market. It might seem weird to be at a food fest. People might not listen, but at least, we have to think outside of the box, because we got to get them where we can. We have to meet people, where we can. And again, other methods,
mm,
depending on the age of your patients, where are they? You
mhm,
might have to make a reel. And nowadays, I'm sure, Benjamin can talk about this. You don't have to show your face. You can just make a little clip with just some words, and then, it comes through as a text message. Somebody's going to
mhm,
read their phone and click that button. It's like, oh yeah, it's 60 seconds. That's all I
mhm.
have. We're going to have to reach the people where they are. We're going to have to reach them where they are.
I love all of those ideas.
Thanks for joining us for another episode of the Exam Room Podcast with Geneva Miller. Today's conversation challenged the way we think about patient education, reminding us that true understanding doesn't happen through a single handout or rushed conversation. It happens through repetition, trust, compassion, and meeting patients where they are. In the next episode, we'll continue exploring the connection between medication reconciliation, value-based care, and patient outcomes. Geneva will share more insights into how healthcare organizations can reduce avoidable hospitalizations, improve communication between providers, and better support caregivers navigating complex health journeys. You won't want to miss the rest of this series. Be sure to subscribe on YouTube, Apple Podcasts, or wherever you listen, and share this episode with someone passionate about improving patient care. We'll see you next time in the exam room.